let's actually start with hospitals in Nairobi County handling COVID-19 patients. Now, tonight we are made aware that they are on a tipping point following the rise in the number of new infections that are already straining the health facilities. The situation has been compounded by the lack of enough oxygen in a number of these hospitals as the Delta variant ravages the city and the country at large. A situation report by the Ministry of Health now shows that Nairobi and Mombasa counties have the highest attack rates of COVID-19 at 1,913 and 1,132 for every 100,000 persons within that population, respectively.
Let us take care of ourselves. You're still out here. If you're not vaccinated, please get vaccinated. If you're not taking care of yourself, please take care of yourself.
It is the voice of Muthoni Muigai, a relative of one of the 551 COVID-19 patients who are currently admitted at the 21 hospitals handling COVID-19 cases in the city. Muthoni tells us that her sister had complained of chest pains before being rushed to the Mama Lucy Kibaki Hospital, where she tested positive.
She was complaining of chest pains and alikuwa na kohoa. Wakatuambia they'll have to refer her to Mbagathi Hospital. So we wait for Mbagathi guys that the guys will call us.
It was while waiting for the ambulance that she realized the effects of the deadly Delta variant, as more patients who had similar symptoms were rushed into the hospital, which at the moment lacks an isolation center and has to refer all COVID-19 patients to the Mbagathi Hospital.
I remember counting 25 patients in 45 minutes. They were being brought in for the same reason. They had the same symptoms. You could see them. They were gasping for air. Others hawako wanaweza kutembea. Wengine walikuwa wanaletwa na wheelchairs. Wengine walikuwa wanafikishwa hapo in the emergency section and then wanabebwa na wapendwa wao. So it was so bad.
Muthoni's sister was lucky to be transferred from Mama Lucy after waiting for 5 hours, leaving behind other patients who were also waiting for transfers. At the Mbagathi isolation unit, she was immediately put on oxygen until Wednesday, when she stabilized before the oxygen resources were redirected to a new patient in dire need. This post on Facebook by one of the patients at the Mbagathi facility was a cry for help, a cry for more oxygen at the facility, pointing to what could be a crisis at most health facilities across the country. The Mbagathi Hospital is among the 21 hospitals around the city handling COVID-19 cases and which are reporting full capacity with more patients in need of supplementary oxygen. Out of the 551 COVID-19 patients currently admitted at the health facilities, 107 are in ICU, while 124 are on supplementary oxygen.
We are a facility licensed by the government of Kenya to handle 43 cases of COVID-19 as an isolation unit, 8 dedicated critical care units. All of them, as we speak, are full. That does not mean we are not getting calls. We are getting 10 to 15 calls every single day for patients who require ICU, and we are not able to help.
Ongeri says that they are using at least 70 cylinders of oxygen on a daily basis to attend to COVID-19 patients, unlike the 10 cylinders that were needed before the spike.
We are going to get into a much worse crisis in the next few days. We are going to lose lives, and we have to be familiar with that situation. If we are not going to take actions to reduce the crisis, we might not be able to cope.
A situation report by the Ministry of Health shows that Nairobi has the highest attack rates of COVID-19 at 1,913 cases for every 100,000 people, followed by Mombasa at 1,132 cases for every 100,000 people. Since the onset of the COVID-19 virus in the country, Nairobi has remained the county with the highest cases of infection rates at 84,138, followed by Mombasa, Kiambu, Nakuru, Uasin Gishu and Kisumu. Wajir County has since March 2020 recorded only 106, becoming the county with the least cases of infections. The report shows that the testing strategy, stigmatization, a shortage of sampling kits in counties remain the key challenges. The writers call on the president to strengthen the enforcement of public health measures.